Today is World Mental Health Day, and the goal is to continue to fight the stigma attached to mental health issues by talking about them, something that we've been doing right here on News Center 5.
Yeah, we're joined by Dr. Rebecca Brendel, a psychiatrist at MGH and the former president of the American Psychiatric Association. Dr. Brendel, thanks for coming in. We appreciate it.
Thanks for having me.
All right, World Mental Health Day. We know that the issue of stigma, though, around seeking mental health treatment is not new. But if there are people in our lives who are struggling, maybe a lot, maybe a little, how can we encourage them to seek out that help?
Well, the best way to do that is what we're doing right now. Have a conversation, reach out, ask questions, and share a little bit about how things are going. Keeping that connection and making sure that people know they're not alone is really the first step.
Yeah, opening up the conversation, right? Well, we've been dealing with so many stressors. We started with COVID, world events. Now we're dealing with this war after Hamas attacked Israel. For people who are prone to anxiety, prone to stress, and they're starting to feel kind of real worry, real anxiety, what's the advice for them?
Well, what's happening in the world is real, and it is distressing, whether it be natural disasters or ongoing wars, acts of terror. The most important thing is really to keep tabs on ourselves and to limit our exposure. We have to keep ourselves well by remembering to turn off the TVs, staying off our phones, and keeping ourselves healthy so that we can be part of solutions and support those who need us.
We've talked about this issue before, the shortage of providers, of therapists, of psychologists, of psychiatrists. Is that getting better? And if it's not, what do you recommend for families? You know, so often you're told, oh, well, you can get an appointment in 2 months. Well, that's usually when you're seeking help, you need it right away.
Well, there are a number of things that people can do, including remembering that resources exist within their communities where they're not necessarily expecting it, in schools, in faith communities, at work, employee assistance programs. Some of the good news is that telemedicine has made it more available to find treatment, even if it's not locally available. And also 988 has been out for now more than a year. And there are crisis counselors at the ready 24/7 if you do find that you're in an immediate need of help.
We know that, and we've reported this, that specifically young people seem to be voicing mental health challenges, anxiety more than ever before. Do you think that's a product of people talking about it more, or do you truly think kids are struggling? And if so, what can we do?
Well, again, really making sure that kids know what resources are there, encouraging them to reach out to a trusted adult, whether it be where they go to school, where they work, really using all the resources available and not being afraid to reach out to each other. The first step is always talking about it.
It's been tough to be a kid the last couple of years, that's for sure, between social media, the pandemic, all the political turmoil. Dr. Brendel, good to see you. Thanks for coming in. We appreciate it.